As we continue to learn more about the coronavirus inside the White House, we want to take a closer look at what this means for U.S. national security. With us now to break it all down is Fran Townsend. She is the senior national security analyst for CBS News. Fran, it's good to talk to you. Hope you're doing well. Can you take us through what the national security implications of having a president of the United States, the commander-in-chief, test positive for COVID-19? Earlier on CBS This Morning, Major Garrett indicated that it's not just our allies who are going to be watching very closely what happens and how this all plays out, but our enemies.
That's exactly right, Vlad. Thanks for having me, and I hope you too are well. Look, I think what's most important, we've just really learned that the president exhibited mild symptoms, sort of a cold-like symptoms when he was at the Bedminster, New Jersey event the other day. People are going to want to know what his actual, now that we know he tested positive, the real question becomes, well, is he able to function? If he only has mild symptoms and he's able to function, people will think of this as a cold, and you'll just assume while he's not doing public events and he may be more out of the public eye, that he's working from the residence just as he would have from the Oval Office. But it'll be important that people know and understand and believe that. I do think our enemies are watching. It's important. It's critically important from a national security perspective that the vice president is fine. He didn't test positive. I think another question people will want the answers to is those around him. You know, is his national security advisor healthy? Those who function around him, are they healthy and okay? Other cabinet members, Secretary Mnuchin, Secretary Pompeo. Reassuring signs to the public will be very important to allies and enemies alike, that they understand that the government apparatus that makes national security decisions is functioning as it needs to.
So, you know, one of the issues with this administration has been at times a lack of being transparent, a lack of being forward and clear about the agenda. And so I'm wondering if, you know, if you were advising this administration now, would you say, look, this is a time to, you know, talk to the media, to be forthcoming, to be clear about what's happening?
Absolutely. So, look, depending on how the president is feeling and what the advice of his doctors is. If the president only had mild symptoms, my advice to him would be to put on a suit and be seen. You know, you can photograph, and you're able to be photographed from a distance inside the residence. I would want photographs of him working, and so people could see. And so to your point, yes, I would be absolutely as transparent as is possible. The president has secure video conference capabilities. He could sit in the residence and you could have the entire cabinet, the national security apparatus, in the Situation Room, and he could conduct a meeting. You know, technology allows him to really function just as if he were sitting in the room. And so all those things I'd want the public, our enemies and allies, to see.
You know, Fran, I was looking back throughout the course of history, modern American history, and of course we know that President Woodrow Wilson suffered a stroke while he was in the Oval Office, continued as president. Nothing really changed. We know that President Kennedy was battling the debilitating effects of Addison's disease while he was the commander-in-chief. President Reagan, as you know, there was an assassination attempt on his life, and through all of that, our Constitution and our system of checks and balances was ensured. The continuity of government was ensured. There was never any question to that. So given some of those historical takes, is there anything at all that our enemies could potentially exploit? I mean, David Martin, our Pentagon correspondent, has reported that there's been no change in our defensive posture around the world. Is there anything for them to grab onto?
I don't think so. I mean, I think based on what we know now, we ought to view this as look, I don't want to overly minimize it, but he's got a bad cold, right? And I think that's the message. He's got the symptoms of a bad cold. We're going to watch closely to see if his condition worsens in some way. But I think that we all ought to just take at face value, the president is doing the right thing. He's quarantining with the First Lady, but he's not suffering anything more than the symptoms of a mild cold.
Are there protocols in place for a situation like this? You know, you pointed out that one of the things that we are all waiting to hear is how other members of the administration and staff, how they are faring, who else is testing positive, and so on and so forth. Because it could be not just the president who finds himself having to quarantine, but it could be other members of his cabinet who are doing really important work.
That's right. And so I do think this is where the transparency is really important. Look, if I was in my job at the White House, I would have wanted, as soon as I knew the president was positive, not only to have the vice president tested, but I'd have had every member of the cabinet tested and insisted that they make their results public, right? That sort of thing, I think, is very helpful and very reassuring. And if the results are positive, then you want people to understand and know how you're handling that. This is a real teaching moment, right, if the president chooses to take advantage of it. You would hope, you asked me what I would advise a president. If he's willing, it's an opportunity to say, we're still in the midst of a pandemic. We have to remember that. It's important that you social distance. It's important that you wear a mask. Now, it's not clear to me whether or not the president will take advantage of this, what I call teaching moment, because, of course, we're very near a presidential election. There's a lot of finger pointing and blame going on because of these large public rallies. And so he may not feel like he can do that right now, which is unfortunate.
You know, Fran, just pulling back a bit, speaking about national security and the geopolitical threats, it strikes me that we've never really been in a situation where we have 200,000 people who have died in this country. You were there on 9/11. You were part of the government on 9/11. That's 9/11 multiplied by many factors. That's some of the wars that we fought multiplied by several factors. I mean, we're in a situation right now where the rest of the world, I mean, in a frank discussion, if we were talking about this in a country that was, for example, in Africa, we in the United States would be saying, the leader there refuses. There are actually specific examples. During the AIDS, at the height of the AIDS epidemic, Fran, you know that in South Africa, for example, you had leaders who sometimes played down the effects of AIDS. You had some of their leaders suggesting that wearing condoms was not effective, right? And here in the United States, we looked at that and we said, well, that's because, that's a terrible thing. And we should do our best to educate people about the risks that are inherent. The rest of the world is looking at the United States. They are looking at the president of the United States who has now contracted this virus. They're seeing the number of people who have died here. They're seeing the spikes that we're seeing in several states. And they're looking and they're saying, the United States is no longer the leader. They can no longer be the moral leader on anything because they refuse to take something like this seriously. I mean, do you see that as a potential threat, or will this all change when the politics of this all goes away?
Oh, Vlad, do I wish it were that simple that we could get this to all go away, when you can set politics aside. No, I don't expect it's all going to sort of fix itself if you can take the politics out of it. But look, I do think the more important thing in terms of American leadership is not whether or not the president as an individual contracted this despite sort of distancing and masks and all that. I think the more important things to look at is our decision to no longer support the World Health Organization, to not join in the 150 nation groundbreaking effort called COVAX to find a vaccine and work on equitable distribution of it. Those are the sorts of things, not whether or not he's gotten sick. When we don't do that, I think those things are the sorts of things that indicate a retrenchment, a lack of American leadership. I think you can change that, though. After a presidential election, I think whoever's elected has a choice to make. Do they want to reengage? Is it in America's interest? I think it is, but the President of the United States, whoever that is after the election, will have an opportunity to change that. And so I think the world will always look to the United States for leadership. Sometimes we'll be there and sometimes we won't. But I think we always have the opportunity to reassert ourselves and would hope we do.
The Secretary of State, Mike Pompeo, he's been traveling. How important is he right now for the White House and national security? And is there anything that he can do to mitigate, any potential threats or what Vlad brought up as a possible threat, sort of our image on the world stage?
Well, look, Secretary Pompeo has not only been a very visible presence around the world by virtue of being the Secretary of State, he's got a very important personal relationship with the president. He's very influential in the president's cabinet. And I do think his continuing his schedule while taking precautions is very important. I think leaders around the world look to him to be the president's voice around the world. And so in terms of reassuring allies and cautioning enemies not to read into this, I think Secretary Pompeo's voice is critically important.
All right. Fran Townsend, thank you so much. It's great hearing from you.
Yeah, we miss you, Fran.
Thanks.
It's been a while.
I miss you guys, too. Thanks for having me.
It's great to talk to you.
Take care.